total hip arthroplasty or a hip replacement surgery. Hip replacement is an amazing option when we're dealing with arthritis that's dominating our daily lives. If you have arthritis in your hip that's hurting, it's hurting in the groin and around from the sides up to the front of the hip, hurting with your range of motion, then total hip arthroplasty may be an appropriate treatment for you. Now, it's not the first thing we do. We are going to start with certainly non-operative management. Non-operative management options include activity modifications, therapeutic exercise, working with the physical therapist so that we can strengthen our core, we can strengthen the muscles that are the support muscles of the hip and strengthen our lower extremities. We can do non-steroidal anti-inflammatories, things like Advil, Aleve, Celebrex, prescription strength. We can even do a trial of the short course of oral steroids like a Medrol dose pack. If we need to, we can even do intra-articular injections. Injections into the hip can be done under fluoroscopy or X-ray, where we guide the needle in using X-ray. Some doctors will also use ultrasound to guide those needles in to try to get relief. When we give you that injection, if we get some level of temporary relief or permanent relief, then we can keep moving forward without having to have the hip replaced for an extended period. Now, if we have one of those injections, we oftentimes wait a minimum of 6 weeks, sometimes up to 3 months before we would generally recommend having your hip replaced. But hip replacement surgery, what we do, we go in, we remove the ball, we remount the socket, we replace the ball and socket with metal and oftentimes a ceramic, and then highly cross-linked medical grade polyethylene, which is medical grade plastic that's inside the hip. So now you have a new ball and a new socket, and that hip pain and groin pain that's been limiting your life is gone when you wake up from surgery. Now, we'll have some soreness and some pain after the surgery. Oftentimes in that area of the soft tissues, we'll see that we've got pain, that we have some weakness occasionally as we get moving. So we need to use that walker so that we can get around. Some surgeons use a posterior lateral approach. Some people will use an anterior approach. Each has its pros and cons. Both replace the arthritis and get you moving, and outcomes with both tend to be outstanding. In terms of the post-operative care, we oftentimes use a walker for a couple of weeks. Then we'll use a cane for a couple of weeks. We then work with physical therapy. Even starting the day of surgery, we'll be in physical therapy, and we'll be doing physical therapy oftentimes up to 8 or 12 weeks after the surgery. Most of the time when we get to that 12-week mark, most patients are feeling 80 or 90%. They're feeling really, really good. But to get to where that hip finally feels like it's your own can oftentimes take 6, 9, or even 12 months after surgery. In terms of activities that you can do with a total hip arthroplasty, certainly things like swimming, cycling are all just fine. Playing golf, playing doubles tennis. We want to avoid high impact activities because we want to make those hips last for a long time. Most of our total joint replacements in the knee and in the hip are seeing longevity time or length of time and lifetime of those hips in now upwards of 30 plus years that we can expect to get from the plastics inside your hip between that metal and plastic that we're putting together. If hip replacement is something you need, we certainly can help you with that. We'll do everything we can to avoid a hip replacement for as long as possible. But when that time comes, as many doctors will tell you, you'll know. And when that time comes, the hip is becoming that dominating factor of your life. It's keeping you awake at night. It's limiting you from being able to get up and make your coffee in the morning. It's limiting you from being able to do the activities that you want to do when your friends are calling you to go out and go have dinner, or if you've got to go do some work in the yard and you're opting not to do that because your hip is such a dominating factor in terms of that hip pain, then it may be time to start considering getting some treatment for the hip. And like I said, we'll move forward conservatively, and if we need to get through and have surgery, we can always do that as well. If you need anything, feel free to contact us.